Rani shares what brought her here. She's always been self-conscious about her nose. She wants it to look slimmer and more defined through rhinoplasty. Rani says she's always admired the smooth, delicate face shapes of Korean idols and dreams of achieving a more elegant and V-shaped look. It can be a little painful, but Anna and the 345 clinic staff are there to make sure she feels safe and comfortable. Lines, symmetry, balance, each mark a step closer to her new reflection. This is Rani, a singer from Indonesia. She flew all the way to Korea for a life-changing transformation journey with Docfinderkorea. It's her first time here, and even though Korea can feel overwhelming, she's not alone. Anna, a manager from Docfinderkorea, is always by her side, from planning the trip to arrival, surgery, and beyond. Rani's pick-up and transfer, like many other services, were all arranged by Docfinderkorea as part of our free services. After a quick ride, she checks into her accommodation, a cozy and modern apartment arranged by Docfinderkorea. Comfortable, quiet, and close to the clinic. It's her home for the next few weeks. As always, Docfinderkorea is by Rani's side every step of the way. Today, Rani will meet 3 different surgeons: Dr. Park, Dr. Han, and Dr. Song, each an expert in their own field. Before her consultations, Rani shares what brought her here. She's always been self-conscious about her nose. She wants it to look slimmer and more defined through rhinoplasty. For a long time, she relied on nose threads and fillers to enhance her look, but now she's ready for a more lasting solution. She also hopes to make her jawline softer and her cheekbones less prominent through facial contouring surgery. In the past, she tried chin fillers to help create that V-line shape, but now she's ready for something more natural and long-lasting. Rani says she's always admired the smooth, delicate face shapes of Korean idols and dreams of achieving a more elegant and V-shaped look. She wants her eyes to look more even and balanced, and also feels that her forehead a bit too big. To improve the overall shape of her face, she hopes to lower her hairline through forehead reduction. Each consultation is detailed and personal, with every doctor taking the time to understand Rani's goals. Dr. Park focuses on facial contouring surgery. He recommends dissolving the chin filler she previously had and reshaping her chin using her own bone, by cutting and repositioning the chin bone, then fixing it with pins. He plans to make it slimmer and slightly more projected. He will also reduce her jaw angles and cheekbones, trimming and removing part of the jawbone, and cutting and pushing in the cheekbones to create a smoother, softer V-line shape. To address the issue of her mouth appearing too prominent, he plans to graft her own bone fragments into the nasolabial folds, making mouth look less protruded. Dr. Song discusses her rhinoplasty and eyelid surgery. He points out that Rani's nose is relatively flat, with the tip positioned close to the mouth, which creates a more masculine and heavier look. To enhance her profile, he recommends using a silicone implant and her own rib cartilage to raise the bridge and lift the tip. Since Rani previously had nose threads and fillers, some of which are still present, the filler will need to be dissolved before surgery, and he will remove as many threads as possible during the surgery. For her eyes, he notes that her current double eyelid line is already high and attractive, but the unevenness between the eyes is noticeable. He explains that this might be due to multiple creases on her upper eyelids, and that double eyelid surgery could give her a more clean and balanced look. Dr. Han focuses on the upper part of Rani's face. He notices that her forehead is slightly large in proportion to the rest of her features. And to create better balance, he recommends forehead reduction surgery. Along with it, he suggests a forehead lift to elevate the eyebrows and create a more feminine, elegant appearance. Throughout the consultations, Rani asks questions, listens closely, and slowly starts to picture the new version of herself. So now it's time to dissolve nose and chin fillers. First, clinic staff applies numbing cream to minimize any discomfort. While it's setting in, Rani gets a health checkup. Dr. Song performs the injection. It can be a little painful, but Anna and the 345 clinic staff are there to make sure she feels safe and comfortable. A few days later, it's surgery day. Rani wakes up early and Anna meets her once again. They walk together to the clinic. It's time to get ready. Rani changes into her patient gown, gently washes her face and gargles with a special disinfecting solution to prepare for surgery and reduce the risk of infection. Then, the doctors come in to answer any final questions she has. They explain all the risks and possible complications, something common for any type of surgery. After that, they carefully draw the surgical designs on her face. Lines, symmetry, balance, each mark a step closer to her new reflection. Anna is there, gently reassuring her and making sure she understands every part of the process. Finally, it's time! Rani takes a deep breath and walks into the surgery room, ready for the change she's been waiting for. This is more than just a makeover. For Rani, it's a moment of courage, self-love, and transformation. And it's only the beginning.